The severe end of the substance use disorder spectrum is where we find the terms that represent what we would think of as full-blown addiction. Another source of confusion that leads to denial is that all these terms, drug addiction, alcoholism, chemical dependency, they all mean the same thing as far as referring to the disease of addiction. But most people don't get this, and it's not uncommon to hear things like, I'm an alcoholic, but I'm not a drug addict, or I'm a drug addict, but I'm not an alcoholic. Here they're just tying addiction to the person's drug of choice. Technically, an alcoholic is a drug addict. Alcohol's a drug and they're addicted to it. The term alcoholic just got coined a long time ago, and singling alcohol out as a separate drug just adds to a lot of the confusion in this area. Now, one thing for families to be aware of, because it's not uncommon for treatment clients to get stuck on this one, is that when it comes to addiction, a drug is a drug is a drug. It's not just about quitting a person's drug of choice or just quitting the hard drugs. Recovery is about abstinence from all mood-altering substances. Even if a pot smoker never touched alcohol, the potential for cross-addiction means that if a person were to start using alcohol after quitting pot, there's a good chance they'd end up using alcohol addictively, or it would just open the door for going back to the drug of choice. One pretty common example of this, especially in adolescent treatment, is the client who acknowledges the need to quit doing Xanax or cocaine but doesn't see any reason to quit smoking pot. I hear more and more parents these days frustrated because they don't know how to respond to the kid who's talking like this. But here's a good example of why it's so important for the family to have a good understanding about the kind of things that the clients are learning in treatment. In Rehab Works, we call this becoming an educated consumer. The premise here is that if you're learning everything that the client's learning, that's going to put you in the position of being able to provide more effective treatment support. So, for example, in the marijuana case, if the parent understands that, no, continuing to smoke pot is not going to be part of your recovery plan, because they know that's what their kid's learning in treatment, they can shut that conversation down pretty quickly. And then in Module 2, when we start talking about setting healthy boundaries, we're going to talk about putting it back on them. In other words, making the client take responsibility for his or her own treatment. They should be the one telling you that smoking pot's not going to be part of their recovery plan. Because they're learning it, they just don't want you to know that they're learning it. Because that could put you in the position of being able to hold them accountable. And even though the client might not like that, that's a good example of the family being able to provide effective treatment support.